Welcome back. We're in studio with Dr. Horst Komarninsky, one of Arizona's top implant doctors. Now, doctor, before we went to break, we were talking about gum disease.
Sure.
What it can happen, what it can cause, and the fact that most people don't realize they have a problem until it's too late. I know you brought a model in, so you can kind of show me the difference between healthy gums and bone tissue and those that have been affected. So if you would take a moment and go over that with me.
Sure, Mike, glad to. When we pull back the gum tissue, when you look underneath here, the bone is all the way, it's even and supports the teeth.
It's pretty level the whole way around.
All the way around. And that's what you would expect to find when everything is healthy. Now, in contrast, when you take a look at the other side, you can see how an area that's been infected by the periodontal infection, the termites of the mouth, as I would call them.
And it eats the bone down like that.
It eats the bone away. It creates infected tissue in these areas. You can see the dark calculus deposits and these little caverns that you can see. We actually call them cavernous lesions.
Now, obviously that can lead to tooth loss.
Tooth loss, looseness of the teeth, discomfort, food getting stuck, all sorts of things can occur with this.
And a little 15-minute check and you can make sure and start to do it. And is it painful to deal with?
In terms of treating it?
If you catch it early enough, if I go in and they find it?
Just like all things, the sooner the better. The easier the treatment is, the sooner you catch this
So you'd be
infection.
doing yourself a favor to go in and take 15 minutes and get checked.
Absolutely. The sooner the better.
Let's talk about implants, because we talk about losing teeth. I've lost a tooth. First of all, what are dental implants?
Dental implants are basically titanium screws that go into your jaw that replace a tooth or number of teeth that have been missing.
Is there a reason? Is there a reason they're titanium? Or did they make them out of other metals? Or they
used to make them. Well, there still are some that are made out of other materials, but titanium is actually a material that's very similar to calcium, and your body really readily accepts that material.
Is there a percentage of how often your body would reject an implant?
On rare occasions, the bone will not bind to the implant, but typically most implants success rates are in the high 90%.
Okay, what can you use an implant for? Can you use it to replace a missing tooth? Can you use it instead of a bridge? What do you use them
Actually, for both those things and others. You can go ahead, a single tooth that's missing, let's say you've lost one tooth that needs to be extracted, that's a great way to use a dental implant to replace that tooth. You can use it if you have multiple teeth missing to replace a bridge or something that's removable, like a partial that you want to get rid of, so you don't want to have something that comes in your mouth that gets food caught underneath, or to support a denture.
Okay, are they as strong as your regular teeth? I mean, if I have an implant put in, can it bear the same loads as my regular tooth?
It can bear the same loads, and maybe in some cases probably more.
Is there any reason that you wouldn't have an implant put in? Is there anybody that maybe shouldn't get an implant, or do they pretty much work for everybody?
That'd be a really extreme situation for someone not to be a candidate for a dental implant.
What about age?
Age is not a factor.
So you're never too old or too young?
You may be too young. You may be a little bit too young because you don't want to put implants in someone who's actually growing. For young women, it's usually about 18. For young men, somewhere in their late teens or early 20s is the time frame.
If I'm missing a tooth, if I lose a tooth and I don't do anything with that tooth, does the bone start to...
The bone will start to deteriorate underneath in that area and be lost, and you might get some recession or a dip in the bone level in that area.
If I put a bridge in, will that stop the bone loss?
No, that won't. That will just, sometimes you can continue to lose bone underneath. It won't stop that.
What about an implant?
An implant will help preserve the bone. It'll help stabilize the bone in that area and also help minimize any trauma on the adjacent teeth.
Okay, traditionally, if I lost a tooth, traditionally they go in and they attach a bridge to the two adjacent teeth.
Correct.
They grind them down, right? What are the benefits with an implant versus putting in a bridge?
Well, the first one is that you don't have to grind down the adjacent teeth.
What happens to those teeth that they grind down? Do they have to do?
Well, sometimes when you do that, those teeth are at greater risk for needing a root canal. And statistically, we know that about 15% of bridges that have been in the mouth will require replacement in about 10 years, and that number jumps up to about 35% in 15 years.
So you have to actually replace the bridge?
Quite often, yes.
How often do you replace the implant?
Very rarely, if ever.
How long do they last, or does anybody know?
Barring something very, very unusual, it should be for the rest of your life.
Can you replace any tooth with an implant? Can you replace one in the aesthetic zone? I
Sure.
know you brought some pictures.
Yes.
And we're going to get to those in a moment, but how long does it take to heal? I mean, if I lose a tooth up front and I decide to get an implant, how long before I can put my tooth on?
Once we take the tooth out, and the vast majority of the time, the best time to put the implant in is at the time the tooth is extracted. That usually about 3 or 4 months later, the crown can go on top of the implant.
How long does it take to put an implant in?
It's sometimes as little as 35 to 45 minutes.
Is it am I out? I mean, is it, because I know years ago, you used to go to a surgeon and it was a giant surgery. Now I understand you're not knocked out, you can be awake while it's happening?
It's all done under local anesthetic. It's actually a very straightforward procedures. Many of our patients will go to work the same day or the next day.
Does it hurt?
We give you plenty of medication to keep you comfortable.
And how long does it take? Are there different sizes implants
Sure.
depending on where you put them in?
There's different sizes, different lengths. It all really matters of how much bone you have for replacing the implant, and also where the implant is.
And how long does it normally take to heal?
Normally, if you have good bone, it can be as little as 2 months. Typically, it's somewhere between 2 and 4 months.
Is there a big risk of infection?
Very rarely. It's a minor risk. But just like with any other surgical procedure, there are some risks of infection, but it's actually pretty low.
So, if I understand, you don't grind down the teeth around it. They last forever. Why are people still doing bridges?
Well, sometimes they think that it's more economical to do a bridge. But you have to factor in the cost of replacing that bridge, which we know a lot of times that's going to need to happen.
Do the teeth that they grind down for the bridge, do they ever, I know, and one of your pictures had 3 implants, and I don't know if he happened to lose 3 teeth, or if he'd had a bridge and something happened to those 2 teeth they ground
Well,
down.
actually that happened. Those teeth had root canals done on them, and there was a part of a bridge, and both teeth that had root canals cracked and needed to be removed.
All right, well, let's take a look at the first picture you brought. It's a single tooth. It's up towards the front. We'll bring the picture up. All right. Now, tell me what's going on here. It's very nice teeth. Lost 1 tooth?
Correct. This is a picture.
Now, I was going to say, what is that in there right now?
That's actually the top of the implant. That's the top of what we call the healing screw in that area. And what's happened is that this patient had a problem with a tooth that's had a root canal. It had broken down and fractured. It wasn't salvageable. Couldn't fix it. So we took out the single tooth, took that tooth out, and placed an implant at the same time.
Okay, now it heals up. He comes in, and you're telling me you can match all the rest of the teeth, so nobody will know that he had
you
one.
can make it very aesthetic.
All right, let's take a look at the next picture. Now this is.
This
now,
is,
which one did you replace?
Okay, it's this one right over here.
Okay, so that is based on an implant. That tooth is there. He doesn't have to worry. There's nothing else going to go. Nothing grinding on the teeth around it.
Correct.
And you matched all the rest of the teeth. And time-wise, how long before he can put that tooth on after he had that implant in?
In this particular case, we probably looked at about 3 months or so.
And then he's done. It's
Correct.
in. It's gone. It's as long as he takes. Is there any special care needed for it? Does he have to do anything?
Nothing in particular, just to keep that area clean. We go over with our patients a little bit about what they need to do right after the procedure in terms of keeping it clean. And the other thing, Mike, also is that at no time, you'll have a fake tooth for a while.
So I was just going to ask you, when I leave, do I have a big hole there?
No, you don't. No, we always, especially with a front tooth, we always make sure you have a tooth when you leave.
So you have a temporary tooth in.
Correct.
Waiting for it to heal.
Correct.
You come back, it's healed up, they put the other tooth in, and other than taking care of it, there's no other real thing. I mean, you just brush it and
You brush it and treat it like you normally would, like a normal tooth.
Doctor, I know we've got to take a quick break. When we come back, I want to get into how you stabilize dentures with implants and what all can be done to make people's lives easier with that. You're watching Medical News Network. I'm Mike Wiggenstein. We'll be right back.